Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. I do a lot with facial balancing as well. So today I'm going to showcase a facial balancing result. This is a really wonderful result of a patient that we did Dilute Radiesse with, also some Bellafill for her. You can see significant improvement in just her overall structure. She's really well balanced over here. This is a patient who had lost some volume as she got a little bit older and really just didn't like the fact that she looked more gaunt. She felt as if she looked older because of just how skinny she looked. We were able to restore this. You know, this is part of what I do. It's not just with scars, it's also with facial balancing, because when we work on scars also, we really want to make sure that everything's balanced also, because a lot of times there's a lot of fat loss, a lot of times there's more laxity due to your scars, and we need to make sure that everything looks really cohesive when replacing some filler in there, some volume in there. So that's what I did end up doing for this patient. This was with collagen stimulating products in this case. Hi Sailor Moon, good seeing you on. This was actually with Dilute Radiesse as well as with Bellafill in this case. You know, she had a little bit of laxity, meaning that it was a little bit looser. I wanted some more elastin production so that the skin felt firmer. And you know, if you feel her skin, I work on her also just for some disport every once in a while throughout the year. And her skin quality is just amazing right now. So this is just with that. So it's awesome. She didn't really have any downtime to be able to do lasers or anything like that. She just wanted something that's just going to be restorative, but also didn't have any fat to be able to do a fat transfer for. So we ended up just giving some Dilute Radiesse and in really select spots some Bellafill. It worked out incredible. You can see, just look at that structure. It's just a lot softer over here overall. So that's you know, awesome, because for a lot of people, they just don't really know that you could do things with facial balancing with collagen stimulating products. Everyone seems to think that you only have to do hyaluronic acid fillers, things that just draw in water, but you actually could do collagen stimulating products, things like Bellafill. You could do Sculptra, you could do Radiesse. All could be options actually. It doesn't have to actually be hyaluronic acid filler. In fact, my preference usually, especially when there's laxity, especially when you know, we want to improve the skin quality itself, we should actually do things that stimulate collagen. And you can see, look at this, you know, the skin quality looks awesome, the volumization looks awesome. And she's actually been able to keep this for years. I did this years ago, and I've hardly done anything else on this patient. Really, it's just been just a little bit of toxin. And you know, toxin is kind of funny, but really a muscle relaxer. Like in my case, or in our case, we use Dysport. I use a lot of Dysport, and that's what I end up using just to help relax the fine lines and wrinkles a little bit. And just that's how we keep the results going. Is this PRF in the patient's face? This was actually with collagen stimulating products. In this case, what I ended up doing was I did Dilute Radiesse and Bellafill. Other options could be actually Sculptra could work very well. You could also do, you know, hyaluronic acid fillers. But as I was talking about earlier, I don't really love hyaluronic acid fillers for the vast majority of these kind of patients, because we want to make sure that when we're doing this, we could really get the skin quality itself a lot better. And we were able to get that there. Thoughts on hydroquinone for small spots on the face? It's really something you should be applying for the full face so that everything looks really evened out. Probably not a great idea just to do it only just for small spots. It may just be that it gets a little bit uneven then. It's not going to be really perfect then for the rest of your face, because usually you'll see that the skin tone is a little bit different depending on you know, the part of the face that you're at. So you'll see that sometimes, like around the eyebrow area, that's closer to your actual natural skin tone, and you want to get closer to that skin tone actually, because you'll see that there, you know, when you're 4 or 5 years old, you went out in the sun, it basically stained it darker then, and it stays with you like that. It'll just stay darker for you. So we can actually get it so that we get closer to your natural skin tone, and I usually use the Pico laser to get that there. Glad to help you about that. Good question though. And let's see here. Where was I here? Help on the aging process, and pores are getting larger. So easiest thing to do is start a retinoid. Easiest thing, really, just consider starting a topical retinoid. You can just pick up different cream, works very well. Just mix it with the moisturizer. That's an easy place to start. Otherwise, do lasers. Lasers work awesome. It's just, of course, it depends on like how much improvement you're trying to get, what you're trying to achieve. But for the aging process, lasers work incredibly well. And we usually still do something like a topical retinoid to help with some of the oil production, which causes the pores to appear a little bit larger. And if the pores are large, really also niacinamide is also something else that helps as well. Niacinamide actually is something that you could consider like adding to your arsenal. Bethany is saying, I want to help under eyes, slight shadowing, but some volume loss. Best recommendations. Well, you could do lasers. Lasers work really, really well for that, or just little tiny bits of filler. And the way I do filler typically is down to the bone. I don't actually do it superficial in the tear trough area. Really, typically, I'm going down to the bone there, so there's some more structure there. And we could do a layered approach, but I really like to have something so that something's deeper there, and it'll look a lot softer actually. So my preference is usually that. Thoughts on Fotona 4D? Everything I've heard is positive. I actually don't have that particular device, but people always say good things about it, and I'm sure that they have a reason to love the device. I just haven't really played around with it, and I have lasers that do similar type of things, so I haven't really needed it. TX is saying best treatments for marionette lines. Honestly, I think the best is probably going to be Bellafill, to be totally honest with you. It's just you have to do it with the right person. But it's really awesome because it's going to slowly improve the skin quality over there, which if you'll notice, as part of the reason why you have marionettes is you may feel like there's a little bit more laxity there. So it's going to help make that skin quality a little bit better. Is there an alternative to filler under the eyes? You could do fat transfer potentially, but a lot of times fat isn't the best spot over there either. So other options probably are going to be really with PRF or PRP, but those aren't going to give volume. So if it's true volume loss, you're going to have to do something for volume. So that's likely going to be like filler or fat. If there's actually like fat herniation where it's just like basically there's laxity over there, the skin is looser, you may need to do something like a surgery, which is basically like a bleph, upper bleph. It means like you just take away a little bit of the skin there. And then the lower bleph is actually where you just take a little bit of the skin. There's like a pinch one. And a lot of times you have to actually push back some of the fat or remove a bit of the fat as well. It's a bigger process, much bigger procedure to actually help with the fat that's pushed out, but it works really well. Do you talk prices at all? Yeah, our prices are on our website. They're just all on our website. Just you can see our prices, and we just have them all there. So you could take a look right there. Opinion on Radiesse in the jaw. So for men, it's good. I like it for men. Especially I use like more something like Radiesse Classic, which is basically just like the pure form of calcium if I'm trying to really build out the bone. But it does get absorbed pretty quickly, I find, in the jaw area. So, there's that portion. And the other thing you actually could consider doing is Bellafill. Bellafill could work really, really well. It's a long-lasting product. It just doesn't give as much lift, but as you start getting some of that lifting effect, then you can start placing some Bellafill in there. It works really, really well, actually, too. And then, of course, hyaluronic acid fillers. You want something with a little bit more structure. Things like really Restylane Define could work really well. And among the Juvederm lines, I usually don't use Juvederm, but you could consider something like Volex or Voluma, all options there. Problem is that there was an epidemic a few years ago where a lot of people were just doing it too superficial in the jaw area. They were doing this cannula approach, and they're making the filler really too superficial. It will look good statically, like if somebody was just like really just staying like just in one spot. And they would always do these photos. You'll see like these photos of somebody with like a sharp jawline in like just like one spot, but then you see it three-dimensionally, it didn't look great, and especially really problematic in the jaw because it's mobile. So if it's really superficial, it's gonna be like this lump, and that's what you'll see. You'll see a lot of that. You'll hear it all the time. I do so much dissolving all the time, so I hear people and they'll tell me that they did the filler 3-4 years ago, 5 years ago, 6 years ago, and it's like, what do they use? Oh, they did a cannula, and that's why it's like bulging, and we gotta dissolve it there. It gets displaced. It's really easy. So really, I'm not a fan of the cannula for a lot of filler. I really don't love it at all. A lot of the times when I'm dissolving filler, it's because somebody did it with a cannula. And when they're doing it with the cannula, they're doing it just too superficial. They're placing it in areas that may be okay at one time, but then with movement, when you're shifting because you're smiling, it's going to get basically draw in some water and then shift a bit in your face. and then the structure of your face shifts, and then also really it could basically cause these mounds. And that's why people talk about this pillar face, and they're concerned about the kind of edema that occurs. And it's like, totally avoidable if you do the right product and the right layer of the skin. And it turns out that a lot of these people that were pushing fillers, it turns out a lot of the people that were saying that there's experts and they're the KOLs, what that means is like these key opinion leaders, and you'll see like, oh, I'm like a Allergan 1%, blah, 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 and like the top 1% account, all this stuff. And, they were pushing it years ago, like everybody was pushing it. And all those same people now are like saying that they love like, the natural look. Well, it's really tough to go from like this bloated, like pillow look to then say that you love the natural look, because it's like, clearly your aesthetic was like this bloated look and you were pushing this bloated look. So it's like very, very difficult to then be able to say that like, you really love this natural aesthetic. It's a lot easier really just to stay in like long lasting, just to really say, showcase that this is how you could stay, just enhancing certain things. People like this patient, for example, she just found that she just looked more tired. She found that she just wasn't looking her best, wanted to do something that was long lasting, that was going to look natural, that was going to look like herself. And we were able to achieve that with collagen stimulating products. That's the thing what we wanted to do. We got it there. We were able to do that. They say cannula is less destructive to the underlying skin. Yeah, I'm not sure what they're referring to with that. I do cannula all the time also because of subcision, things like that. It's, certainly it's helpful if you're trying to avoid vessels. That's true. Like in certain areas you want to prevent vessels. It could potentially help prevent bruising for some spots, but it's, destructive. I'm not sure what anybody would mean by destructive there. The needle is very, very precise. You could go directly at the spot that you need to and just rebuild the areas where you lost a little bit of fat. Compulsiveness is saying, I've never had any issue using a cannula. That's perfect. A lot of people would say that they wouldn't have an issue with it. But the thing is that I do so much dissolving. We have an ultrasound. I have people from all over the country that come in just for dissolving. I had a patient the other day who flew in all the way from Indianapolis, and he had a filler in the under eye area and in the nasolabial fold. And when he was smiling, it was like pushing it, and it was really edematous. And so, it was for the cannula. And it's like the story is almost always the cannula. The patient I dissolved today with another lady today was with the cannula. And it's like over and over and over again, you hear that story. So I'm not saying that it has to be, that it's going to cause a problem, but you're more likely, it's easier to cause a problem. It's easier to not be in the right layer if you're using a cannula. If you think about it, it makes a lot of sense. It's really possible then to be a little bit too superficial. It's really possible really that your cannula is not exactly in the right spot. How do you feel about filler to the upper eyelid hollows, and is filler under the eye for darkness bad? So filler to the upper eyelid, I think it's terrible. I think it's a really, really bad idea. I would not recommend it at all. I've actually dissolved many, many people with filler in the upper eyelid. And in fact, they were actually ready to do surgery, and then they ended up not doing the surgery because it was really just filler. We looked at it with the ultrasound. You could see that there was a lot of filler over there, and we just had to dissolve. So I would not recommend that at all for the vast majority of patients to do filler in the upper eyelid. Actually, there was a patient who he went to a dermatologist, and that dermatologist put Sculptra in the eyelid. I don't know what they were thinking with that. I think supposedly it was for like a scar treatment, but it was a terrible idea, terrible mistake. And so that was a big problem also for a patient too. But there's definitely risky spots to do filler. There's places you could do it really safe and you could get a really, really beautiful result. This is one of them. The neck is also a really, really good idea too. You just got to be careful about who you're going to and the kind of product they're using. In the neck area, you never want to use Sculptra, for example. Bellafill, I don't do either, but I do actually love Radiesse. So it's a very dilute form of Radiesse, can work very, very well on the neck. So that's what I'd recommend. But I wouldn't recommend a lot of other products there. Does dissolving ruin your tissue? There's no actual evidence, like actual clinical evidence that it does, but I use an ultrasound to just go directly at the spots of filler. Today I was literally just tracing those little areas that I need to with my cannula, with the ultrasound, just go right in the pocket of filler and dissolve right in that spot. And so I just go right at it. And my argument really is that the filler is just really displaced, and it's causing the skin to stretch. It could potentially block the lymphatic system, especially around the eye area. And that's actually causes a lot more complications, a lot more problems for patients. And these people that are pushing that filler or hyaluronics is destroying their tissue, first of all, there's very, very few people in the country that use ultrasound to dissolve. Very, very few, maybe like a handful of people that I know of that do it in this country. And we're very, very precise with that. But the truth is that if you're going to somebody who has to dissolve it and they're not using ultrasound, then it's probably better though than what's happening with this filler, because it's probable that the filler is actually stretching out your skin and causing more complications, especially these ones that draw in water. I'm just not a big fan of hyaluronic acid filler. I like it for some spots, like certain select little things, but I'm not like a huge hyaluronic acid person at all. I've never been, actually. My whole practice has been more with collagen stimulating products. Like that's really which is what I did. And everybody was telling me, that it's something that really I should be getting out of. They were telling me that, why would you use Bellafill? Because literally, I mentioned this before, but I'll tell you again though, that, I had a physician when I went to a conference and he was telling me, why are you using Bellafill when it lasts so long? Because it's bad for your business. It doesn't make sense from a business standpoint. You won't have these patients over and over again. I have my patients come every 6 months or so for filler. And this was a few years ago, or, maybe pre-COVID, I can't remember exactly. But it was it was eye-opening to me, because the concept is basically just to keep on marching up patients over and over, and just continuously having them do the hyaluronic acid filler. And that's how they end up getting bloated and things. And that particular person, that physician, by the way, is like this key opinion leader. He is somebody who's speaking for these guys and all this stuff. I'm not sure if it still was at the time though. And it's pretty interesting, right? That's a pretty eye-opening thing though. And so they're basically bought by the companies, paid for by these companies, and then they're pushing their products and telling you to do this in a certain way. And why are you using products that are long lasting? This is something that's not good for business. That's what they're telling us. They're telling us that it's not good for business to do things that are good for the skin and do things that are long lasting, because then you won't have them come back and forth. It's pretty interesting when you actually think about it that way, that there's actually people who switch like that. They think like that. And it's very foreign to me. What are the safest areas to inject filler in the face, and which are the most dangerous? So typically the most dangerous areas are really in the midline area. So basically the glabella area, very, very dangerous. Nose area is dangerous. Even the nasolabial fold could be dangerous as well. And even the chin could be dangerous as well. So pretty much everything along the midline. Forehead is dangerous as well. That's not to say that you shouldn't get it done there. You can't get it done there. It just means that be really careful about who does it there. I do probably 1 to 2 forehead fillers every single day. I do nose filler once or at least every other day. So it's really, I do a lot of it. And then nasolabial fold, I do every single day. So that's a lot in those areas. And there's a way to do it, there's a clear way of doing it. You could do it very, very safely. But we could, we have to do it in a certain way. I move my cannula, I make sure I'm not doing too much pressure, things like that. Mrs. Jones is saying, can't wait to schedule my virtual appointment. I will look forward to it, Mrs. Jones. Really do. You definitely have to tell me that it's you. I don't know if your real name is Mrs. Jones or not. So otherwise, if it's not, then I'm not going to be confused if your last name is not Jones. Rail with Art. Hey, Doc, how many sessions with the Cure Laser and how often do I need to do them to see results? Most patients do just 3 sessions. Some people do need a 4th session though. So you have a 4th on file, but most people just need 3 sessions, and it works incredibly well that way. Let's see here. Do you treat back acne scars? Yes, we do. Usually that needs more volume. So a lot of times I use Bellafill or just lighter lasers. I usually don't want to use too aggressive lasers. Things like CO2 lasers could potentially be too aggressive, and I don't love it for that area. Body in general, I'm a lot lighter with lasers than I am on the face. Just doesn't heal as nicely. It's potentially could cause more scarring, a lot more risk, a lot more pigmentation issues. So I typically do more with collagen stimulating products like Bellafill, for example. Do you have any pictures of someone who had any scar treatments years ago to see how they look now? Yeah, I did a few of those about a week or so ago. I'll try to showcase that. I'm almost at the end of tonight, so I'll try to do it tomorrow. I'll try to showcase somebody from a few years out or so, and then you could see. I haven't seen that like the one I'm thinking offhand that I showed recently. I haven't seen him recently. I think he's going to come by in the fall time again. Well, hopefully I can see another cool result then too. But yeah, I have a lot of patients from years ago. Some actually, one of them reached out recently and said that they were letting me share, and that'll be really cool because she was somebody from almost like 7 years ago or so, and her skin looks amazing, so it'll be really cool. The girl in the photo, how many syringes did she need? I have to double check offhand. It's been a little while. I usually do about 2 dilute radiesses, and I did like probably about 2 Bellafill as well for like the temple area and a little bit in the along the bony part, the orbital bone area there to help. So, and I also did her lips as well, I believe too, and some in her chin. So a few different spots actually right there. So a few steps, but we got really, really great results there. How long do the indentations last after dissolving a substantial amount of cheek filler? Well, it depends on how displaced the filler is. And sometimes it's just like, you know, one of my patients today, the one I was talking about, where she had a lot of filler in the mid cheek, I dissolved it and she looked younger just right away. You know, so it's like she was worried that it was going to look like it was indented, everything like that. And it looked awesome. And because I'm very, very precise as I'm doing this too. I'm just taking the bits that I need to. And it just looks awesome. It looks like she's just younger now. So, which is awesome. And yes, thank you so much, Mrs. Jones. Appreciate you. And I know I missed a bunch of questions on here, so I'll try to catch up. But let's see here. If I miss anybody, let me know. And I'll try to circle back before the end of the night. I have a few cases tomorrow in the morning, so I'm going to leave in just a few moments here. But Law of Trends is saying, literally just booked a virtual consultation. Appreciate you. Really appreciate you. Compulsiveness is saying that didn't really answer the question. Well, it's tough to say. I don't know. I mean, how do I know if it's going to be, like if it's really fold up, if it's like really, really pulled up, then it's possible that it's like, you know, if it's really puffy, it is going to potentially look like it's indented because we took away your, you know, we took away the filler that was there, and then it's going to be like potentially like there's some volume loss. But yeah, I'm not sure. Like, you know, I've never really seen much of a problem in this area, especially the mid cheek area. It's not an area that really should have fat or volume in there. Like even little babies you'll see are going to have some flatter than a lot of people walking around Newport Beach right now. You know, like they have like this big bulge over there. And the cheekbone area, it's like if there was a filler over there and it was supporting a significant amount of fat loss, then you are going to see that fat loss again there. And I'm not sure if you're going to get that back unless you do volume again in that spot. So it's tough for me to kind of answer this without evaluating what's happening there. If you're referring to the fact that like you dissolve and you're talking about the skin, like how long does it take for the skin to contract? That can be just even a couple of weeks. You'll see the skin contract for a lot of people. Sometimes though, it could take even longer. There's a patients that have been like 3-6 months actually, where it takes a little bit longer for the skin to contract a bit there. So it really just depends on how much it's like stretched out really. Is Verteporfin promising for atrophic scars? I hope so. I mean, it'll be, you know, I have the product and it was expensive, so I hope it would be. But you know, some people have showed me some of the results that they've done, but it was really poor photos, and they were telling me that they didn't really see much improvement with it, but it was really poor photos. So I can't say that you know, I'm going to dismiss it because of those cases, though. It's, you know, I hope it does. It's I think it's a cool concept. There's a lot of different options that we could do, and it's just that the way that they have the drug is also going to be very, very complicated for a lot of people to be able to do. It's like very expensive. It's going to be tough for people to do outside of like certain centers, I would say. In surgery, but for surgical patients, people, let's say they're doing a breast lift, things like that, I think that it could really shine with something like that if it works out really, really well and do really, really well with that pretty quickly. Does under eye filler always go wrong? No, it doesn't always go wrong. Some people like it's awesome. You know, so I've had under eye filler, and I'm happy with it. I think that there's a little bit of hollowness, but I just sort of just accept it. Like I just don't really just push it. So that's kind of the key, honestly. You just have to sort of accept the fact that it's never perfect. It's never 100%. It's very, very difficult for people to see because they have seen over and over and over again on social media that's supposed to be just completely flat when they do under eye filler. But what can end up happening is that you know, it could be that you overfilled it and then it draws in too much water eventually, and then it ends up causing a problem. So if it is like completely perfect in those results, chances are you may run into problems. You know, it may be a problem down the line. It's not a problem right now today, but down the line it could be a problem. So that could end up being the case. So I don't believe in doing it like this perfect type of way with the under eyes because it draws in water there. Less is more. Yeah, absolutely. McLennan is saying, what did you inject under your eyes? Which filler? So I did a bit of Bellafill for like the orbital bone area and my mid cheek where it's like a little bit, just a tiny little bit there. And then I did a bit of Restylane Classic as well. So Restylane Classic, which is deep to the bone, that worked out really, really well. So that's what I use. And I just, like I said, I accept that there's going to be a little bit of hollowness. It's just like, okay, it's fine. How long does Bellafill last? So it's FDA approved for 5 years, but really most people would find that it lasts a lot longer than that. It's not really going to get absorbed as vast majority of, we really would find. I've had it for 7 or 8 years at this point. It's just like, it's there. It's like perfect. How long to see full results of Bellafill? Honestly, I think it takes like a year and a half sometimes, really. Maddie Gee is saying, what are your thoughts on collagen bombs? I saw your question a few times, Maddie Gee. I don't even know what collagen bombs are. I don't know if that's something that's going around. I don't know what that is. Manuel Garcia is saying, can the acne scars be faded naturally without filler? If they're superficial, then yes, it's possible that it could be. If you may not need much with a volume replacement then of that. But if it's, if there's a lot of fat loss there, you probably do need something for volume. And that's going to involve either Bellafill or Sculptra, Radiesse. Hyaluronic acid filler, of course, could be an option, but typically you want to do something that's going to make the scars themselves a lot better. I'm going to finish up with this question here. Ray is saying, if I get Subcision with filler, do I need to keep getting filler forever? Well, you are going to lose your fat, but you could do Bellafill. Bellafill is awesome. It could stay there. It could continue to make collagen. 20% could stay there as well. And that's awesome because it always supports that scar tissue there. Two Wolves are saying, can you use Bellafill for lips? No, you should not inject collagen in the lips. It's too reactive for the lips. You're also moving around a lot too. And that's something where we actually could run into problems where it could get lumpy. It could cause these nodules. So I would not recommend it there. Do you always use an ultrasound to see if scars are tethered? You can see scars really well with the ultrasound that I currently have. I'm getting a new handpiece. It's going to take a little bit of time for me to get that though, but I'm getting a new handpiece that should be able to see the tethered bonds as well. Not sure if it's really going to be necessary other than just for like academic purposes, but I will do it though, just for, just be able to see, especially for like second steps, third steps, if we need to for patients, I could be able to see it that way. But maybe I'll put it, I'll incorporate a lot more too. The one I have right now, it's excellent. I could see like filler perfectly. You could see the scar tissue itself too. I'm getting another probe that's going to go to like 70 hertz, going to be high quality. I ordered that. I think I told you guys a couple of days ago when I ordered it, so it's going to take a while for me to get. But once I get that, that's going to be really cool too. Just like if for academic purposes, we can see that there. How do you get rid of the fibrosis tissue in the zygomatic area caused by filler? Good question. That may require, if it really is true fibrosis, potentially just a little bit of subcision, potentially if it's like tethered or stuck, or if it's like just like a firm area, maybe a little bit of steroid injections. And, it depends. If it really is truly fibrosis, sometimes you'll be shocked though that what people were saying that was scar tissue actually turned out it was just more filler there, and dissolving the filler just solves it. Ray is saying, so when the Bellafill gets absorbed, will my scar look the way it did before? Yeah, that's a good question. I mean, it's very important to pay attention to what Bellafill really is. Bellafill is 80% of it is cow collagen, 20% is PMMA. The 80% cow collagen goes down sometimes in a 1 to 2 months or so. And then that 20% PMMA stays there, and your body continues to make collagen around it. So there's always a scaffold over there. So that 20% PMMA is there. It's going to give you a little bit of volume there. That collagen you get to keep. That's like your collagen. It's your skin quality that's better and better over time for that scar. And I see it myself, my own face, see it really for everybody else too. So it works really well. And it's I personally think that the best way to treat scars is to have something that always supports it. You want something there that's going to stay there really and slowly really integrate with your own tissue and create your own natural collagen. It works very, very well. Radiesse works very well too, especially for patients when there's a lot of laxity, there's a lot more volume loss. Radiesse can work well, Sculptra can work well. All good options really for patients. Interesting. So it's much better than Sculptra. I prefer it for like more discrete areas because it's very, very precise. It'll stay underneath the scar really nicely and it'll just integrate with the tissue. It's not going to shift. It's exactly where you need it to be. So that's why I prefer it really to Sculptra for smaller spots. But I use Sculptra all the time. I did about 3 or 4 cases today with Sculptra, and it was really with more volume loss. Actually, the cases today were very complex cases, actually really complex. The amount of fat loss, the amount of volume loss that I had, I really had to do things with Sculptra to really help lift it up and to give you a little bit more volume. And that's what I usually use Sculptra for. Let's see here. I know I missed a few things. I'll answer a few more here, though. I think I answered this fibrosis in the zygomatic area, which is a good question, by the way. Where was I at here? I had an armless lift. My scar goes from my armpit to my elbow. What do you recommend to soften the scars? If it's darker, you could consider the Pico laser. Otherwise, you could consider something potentially like, if it's more like texture, like erbium laser could work well. McLennan saying, you have amazing cheekbones. Can a similar look be achieved with filler? Thank you so much. I mean, I was, that's actually partly why I did this. I wanted to actually get to that point. I would like say that when I was looking at myself when I was younger, I always wanted a little bit more structure on my cheekbones, and I was able to achieve that with Bellafill. So that's what I'd recommend, really. You could slowly just putting little bits of micro droplets of Bellafill over there worked incredibly well for me, and it's something I'm a big believer in. It's like interesting because a lot of people, like I told you, that there's that doctor who was saying that why do you use Bellafill? People don't come in every 6 months. It's too long lasting. Like for someone like me, I don't want something that I have to do over and over again. I just don't have the time for that. Even though I'm around this stuff all the time, I want things that last. I want things that are going to make my skin quality better. And that's where Bellafill really shined. So that's what I ended up doing. Andy's saying, hi all, I had Subcision done this afternoon and the area looks 1,000 times better. It feels like I got my chin back. Well, yeah, if you got Subcision done today, it is going to look a lot better. That means that you like a lot of volume, and the volume really could be replaced over time slowly with things like Radiesse, Sculptra, things like that. That's what you should really consider doing. But I'll tell you, like, don't be discouraged because your subcision swelling is going to go down, and you're going to see the scars again, and it's okay. You just do volume. Do it like a month or so from now. It's going to be a ton of swelling. Yeah, Applejack's saying it's probably swelling. It's probably a ton of swelling. You just did Subcision. There's tons of swelling. So it's good that you like it. I'm glad you like that. You know, and you're not one of my patients, but like I'm glad you like that because it probably tells you that you just should do some volume and talk to your physician who did it for you and ask them about considering doing some volume replacement there and slowly doing it there. What is the spelling of the filler you're talking of? Bellafill. I'm talking about Bellafill. B-E-L-L-A Fill. F-I-L-L. Bellafill. Actually, is it one L? I think it's 2 L's. And I appreciate you guys. Thank you so much. But actually, why am I drawing a blank on Bellafill here? Why is it? Is it 2 L's or 1? Okay, I was right. 2 L's. B-E-L-L-A-F-I-L-L. Bellafill. Perfect. Best for temple scars. I think Bellafill's the best for temple scars too, honestly. Sculptra works really well for that too. Bellafill works really well for that. You could do hyaluronic acid filler if you want, but like I was saying, I don't really love HA filler too much. What do you think of people being scared of subcision causing drooping or damaging surrounding muscles? You know, I would be scared of a lot of people too that do this stuff. I would. I wish I could say I'm not, but I would be scared of it, you know. I see the way they do things. They're really sometimes too reckless. I see people are just really not sanitary too. I'll be honest with you, there's a lot of people who are not sanitary. Anybody who's like worked with me, everyone who knows me, I constantly am like, this is like sterile, this is sterile, this is sterile, this is clean, this is clean. And you'll be shocked. Like there's like surgeons out there. I've been in the ORs for some people before, things like that. And it's like, sorry, not ORs, but like procedures like in a clinical setting. And it's like, man, like the people are like just not clean. They're not, like surgeons, a lot, like Bethany's asking who's dirty. There's a lot of surgeons who are not clean, and a lot of like people in this industry who are not clean. And it's like they're putting like the cannula. I'm no joke. I'm totally serious. They'll have like they went inside the skin and they have the cannula and they just put it on the mat. And it's like, man, WTF? That just happened right now in front of me. Like, what just happened right now? And yeah, the thing is that people seem to think that these gloves are sterile too. These gloves are not sterile. They're not sterile. They're not sterile. Like, they're not sterile. Like, I don't know how many times like people need to understand this, but like people think that like you're wearing gloves and like they're sterile now, and you could just like go touch like people with like, and it's just like, wow, this is just wild stuff right now. And so I get really concerned a lot of this stuff. There's a lot of people that just aren't clean. There's a lot of people, honestly. I had like, these terribly disgusting roommates in college. They were just like so nasty. And I was always like, I may have been like a messy type of person. Like sometimes I'll leave like some clothes and things like that out, but I was never like, nobody could ever say I was dirty. Like I always made sure like there was no food at the table, like anywhere, like everything was clean. Like my mom was always saying like, just make sure things were clean. Like things were clean. Like, yes, she was like, sometimes like my bed was not made or something like that, but like I was clean otherwise. And these dudes would like just have like it was like literally they would eat out of paper plates, and they were having their dinner on paper plates, and they were just stacking their paper plates. Dude, you got paper plates. Why can't you just throw your paper plates in the trash? Like, think about that. Think about how dirty of human beings these guys are. Just imagine what they're doing out there, and they're walking around and they just couldn't even throw away paper plates. They were so lazy, they weren't even using dishes, and they were actually just keeping the paper plates just stacked like that. It was so nasty, so disgusting. Actually, I had to force my way out of that unit. They were making a big deal about it, but yeah, that was a flashback actually. Wow. But yeah, so a lot of people really are actually just very, very dirty though. So anyways, needless to say, I would not trust a lot of people when it comes to a lot of different procedures. So really, I mean, if you look at you could actually just pay attention to see who's clean and just notice it and just see like who's looking at like their like these gloves. I'm not talking about the sterile gloves. Sterile gloves are sterile, of course, right? But like they're just grabbing their gloves with dirty hands and they're just like touching everything, and then they touch your face, and it's like, every time I touch a patient and then I like go touch the laser, I'm switching gloves out. I'm doing this, I'm teaching out. So it's like, I don't know. There's a lot of people that don't do that though. There's a lot of people that don't do that. How would I know if I got a solid guy for the job then? You could tell me, actually, maybe I won't tell you if they're solid, but I could tell you like some people, like maybe I won't say a negative thing about the person, but I guess I'll say a positive thing if you mention something. So there's that. So if you tell me somebody, I could tell you a positive thing if it's like a positive thing. If you say, hey, I'm going into this person, and if something positive, I'll tell you something positive about it. Otherwise, I'll just stay quiet there. Where did I get my passion for medicine? That's a good question. Honestly, I tried to avoid medicine for a long time because my dad's a doctor, and I was like considering it, but I was thinking, it's obvious, and like everybody's thinking I'm going to be a doctor. I was like, I'm going to like rebel against it and do international relations and like try to go down that route. And then I was like, man, it's just like, I went to international relations. I was like, international like legal structure is just like garbage, and it's just like a joke. And we all see what international law is just like it's just garbage. I knew it was all based on like power dynamics, and none of it made sense. I was like, I'm never going to do that. And then I was like, forget that. And then I was like, maybe I'll go to law school, and I got into law school, was like ready to go to law school, worked at a law firm, and I was like, God, this is terrible. Like they're just like billing me. They're billing their clients when like they were like having me go fetch like the charts upstairs in the attics, and like they're billing for that time. And it was like 15, 20, 30 minutes they're billing for me to just go grab a chart. It was like literally like took me 2 minutes. I was really fast a lot of times too. I was like very fast, get the thing there, and I'll go back, and they're like, here we are. A lot of trends attacking us over here. Really, it's like, what can I say? That's how it is. I mean, this is business law though. It's a really big firm over in Chicago, and I was looking at it like, this is just terrible. The system is terrible. I could just never do this. I'm never going to be able to be this kind of person that's just going to be like, and then like, no offense to law of trends. My sister's an attorney too. She's actually, I have a lot of respect for her. But the thing is that like, I've never seen any other practice which charges the client for research. Like if somebody on here just says to me, what is this medicine? Or if a patient asks me, can you go like explain this medication? And I don't know the answer, and I have to go look it up. I'm not going to go bill the patient now for the fact that I didn't know that answer. That's just ridiculous. Like law is the only field in the world where they're going to actually bill you for the fact that they didn't know enough information about something. It's not my fault you guys don't know. Like, how is it my fault that you weren't educated on something? Go like figure it out and then come back to me and like give me the answer, but then don't bill me for the fact that you have to look it up. It's the only practice in the world that does that. Actually, it's wild. And so like I was just like, I'm not gonna do that. I'm never gonna do something like that. So that's when I was like, I'm just gonna shift everything. So I had to go do like a whole post-back program, and I was stuck in like the middle, like nowhere doing that. And then the rest was history. Then so that's my answer. But yeah, that's like really, it's like you know, a long journey, a roundabout way of doing it. But I did like, I'll tell you, I did actually like the LSAT. I like the logic games. And then it turned out they got rid of that too, though. I don't know why they got rid of that, but I like that part. Does weight gain affect fat graft or only weight loss? Well, it's your fat cells, so they're going to expand with weight gain. Weight loss, it's going to be fat cells, and you could lose that too. I'm interested in the ultrasound you use. I want to know so I can ask doctors if they have it. We have like some videos of it. You could take a look and see some of the videos that showcase it. You can see, I mean, it's a very expensive device. So I don't know if many doctors are going to get that $4,000 to $5,000 one. This is like a lot more than that, like a lot more. And I'll tell you, it's a really good device, but like I do so much of it, so I'm not sure who else is doing that much of it. But they usually use a butterfly one, which is actually pretty good though, for like a lot of times for like filler, like dissolving. It's pretty good. But this is like, you can see a lot with it. So yeah, it's a really good device. You can see some of the videos actually. You can see like, we can see very clearly with that. So I love it. It's actually awesome. Anyways, guys, thank you so much. I appreciate you. I will see you again tomorrow. And someone was asking for like a longer term result. So I'll try to find some people for longer term results. Like I said, there was a few people that were asking for with the longer term results. I'll show that. Oh, someone's asking, this is actually a good question. I'll just answer it really quickly. Do punch excisions look far worse initially? I've had a bunch done and they look horrible. Sometimes they could. For the first 2 to 3 months, they could look worse before it contracts. And a lot of times that's due to oil production though. So talk to your physician, whoever did the punch excision. It depends on how it was done though, of course, but sometimes it could look worse before it gets better. And you may just need to do other treatments too. Don't give up though. Honestly, I fixed a lot of punch excisions that were a little bit wide. Sometimes I have to consult one of my patients today even actually. She thought that the scar looked worse, but it was actually like more, like I didn't even do it, but like she said that it was like, she thought the scar was worse, but it's like, it's actually just wider and superficial. You could tell it's superficial there. So it's like, we just could laser that away and it's going to be okay. So